The first visit in any doctor's office can be a stressful environment for a patient. I've been there myself as a patient in a doctor's office for the first visit, and it's stressful. So let's talk about it. In our office, we use the first visit to do an extensive fact gathering expedition, if you will. We're going to talk and do a consultation. We're going to do a hands-on examination with orthopedic testing, neurologic testing, palpation, the typical stuff that you would experience in a doctor's office. Then we're also going to utilize technology. We're going to use digital x-ray and digital motion x-ray so that we can see not only what your spine looks like when you're standing in upright posture and from the side. We're also going to look and see what your spine looks like when you're bending, when you're looking up and looking down and bending from one side to the other side. And we're going to be able to compare all of that, your static or still x-rays and also your motion x-rays, to normal, so that we can see exactly where your spine has shifted or where it doesn't move properly, where you have postural imbalances, and create a plan for you based on that. We'll also use digitization to look at your posture from the outside. So we'll use technology to do that, and we'll use technology to do functional movement, functional motion screens as well, where we'll video you squatting down and standing up and doing different motions so that we can see how does your body move in general. Are there any muscular imbalances that need to be worked on? So we take all of that information, and it's a ton of information, and use it to customize a plan for you to achieve your goals, to achieve the reason why you came into the office. It's usually not just reducing pain, it's usually being able to live your life the way you want to live. Right? Playing with the kids, doing hobbies, getting through a day of work without it being excruciating, being able to sleep through the night, that sort of thing. So we'll create goals, and then we'll design a plan to work towards them, and it's always a customized plan based on your exam findings and what you need done. So we go over all of that on the second visit so you know exactly what you're going to need throughout care. Then here's the cool part. I think that's already pretty cool what we've discussed, but as we go through care, I think it's even cooler, because this is when we do repeat exams. So anything that we found on the first visit, we use the same technology, whether it's repeat x-rays, repeat functional movement screens, whatever it is, and we compare your progress as you move through treatment so that we know we're on the right track and we know we're getting you to where you need to be. It also helps us to know when you're done. When have we achieved what we needed to achieve and your spine moves and looks normal? So it's a great process. It's always customized. It's always focused on exactly what you need.